How to manage your diet before radioactive iodine therapy. Preparing for radioactive iodine therapy involves more than just scheduling your appointment. One of the most important steps is managing your diet carefully to make sure the treatment works as effectively as possible. The key is following a low-iodine diet, which means limiting iodine intake to less than 50 micrograms each day. Iodine competes with radioactive iodine in your body, so reducing iodine levels helps your thyroid or thyroid cancer cells absorb more of the radioactive material, improving the treatment outcome. Start this diet about 1 to 2 weeks before your therapy. This gives your body enough time to lower its iodine stores. You should continue this diet for about 5 to 7 days after the treatment as well, to maximize the effectiveness of the radioactive iodine. Avoid foods high in iodine, such as iodized salt and sea salt, because they are major sources of iodine. Steer clear of seafood and sea products like fish, shellfish, seaweed, squid, shrimp, and dried fish. Dairy products like milk, cheese, yogurt, butter, and ice cream are also rich in iodine, so it's best to avoid them during this period. Egg yolks and foods containing eggs should be limited, though egg whites are generally safe to eat. Be cautious with sauces and seasonings like fish sauce, oyster sauce, soy sauce, and fermented fish paste, as they often contain iodine. Also, avoid bakery products that may contain iodine or iodate dough conditioners, and watch out for chocolates that contain dairy, especially dark chocolates with added dairy ingredients. Red food dyes, especially red dye number 3, are common in processed foods and beverages and should be avoided. On the flip side, focus on eating low-iodine foods. Fresh, frozen, or canned fruits without added salt or red dye are safe options. Vegetables should be fresh or frozen without salt, and soybeans are best avoided. Unsalted nuts and nut butters are good snacks. You can enjoy fresh meats like beef, lamb, pork, chicken, turkey, and veal, but limit your intake to about 6 ounces per day. Egg whites are safe, so you can include them in your diet. Grains like rice, pasta, and bread without high iodine ingredients are suitable. Sugars and sweeteners such as honey, maple syrup, and jam without red dye are fine. Use vegetable oils including soy oil and vegetable shortening. Beverages like black coffee, tea, fruit juices, lemonade, sodas without red dye, wine, and beer are all acceptable choices. It's also important to avoid restaurant and fast food meals, as the iodine content in these foods is often unknown and iodized salt may be used during cooking. Always check your medications and supplements with your healthcare provider because some may contain iodine, such as certain expectorants or topical antiseptics. Avoid herbal supplements unless your doctor approves, since their iodine content can be uncertain. When drinking water, stick to tap water unless your local supply is iodinated. In that case, distilled water might be a better option. Following these dietary guidelines helps ensure that your body absorbs the radioactive iodine more effectively, which can lead to better treatment results. Remember, always consult your healthcare team or a registered dietitian for personalized advice before making any changes to your diet or medications. This approach aligns with established medical guidelines for thyroid treatment and aims to support your health and safety while maximizing the benefits of radioactive iodine therapy.